It was more, this one is not a specific story in itself, like my usual stories. This is more of kind of a realization, you know? So it's going to be 10 years in May that I've been a doctor. So 10 years in the game, man, in one game. Obviously, different hospitals, different specialties, that kind of thing. But now, kind of, you know, towards the more senior end of my, let's say, career. I've kind of been in the kind of same kind of work, I'd say, for the past 5 years now and kind of developing that role. And it was the realization that at work, I am a leader. And it was interesting because it's not like somebody doesn't come up to you and say, hey, you're a leader, right?
Yeah.
And it's not like in, say, like a business sense where you have like manager. And although there are, you know, obviously doctors have titles like based, let's call them ranks, right, of seniority and things. So consultants at the top, I'm registrar, I'm a senior, what we call a senior registrar. So maybe after like a year, a little bit, you know, I'm equivalent to a consultant as well. So I'm pretty senior, but obviously people know that as well. But beyond that, you know, they see me as an approachable person, and that kind of outweighs any kind of title or rank, right? So, but no one says to you, hey, you're a leader. But then the other day I walked into, you know, the bit where I work, and I was just checking in. And as soon as I get there, I have like a routine, you know, take my stuff off, I drink my coffee, fold my scarf, get my logins, you know, sorted. I check all my patients from the day before, read all that, and I'm ready to start today. And a couple of people came in, like, hey, Jazz, hey, Jazz, hey, Jazz. And then this one person came in, was like, you know, I'm so happy you're here. I just feel so much better that you're here. And I was like, you know, that's obviously a really nice thing to hear. And then you know, just left like smiling whoever this person was. And then I was thinking about it, and I was like, you know, it's such a nice feeling when people feel safe, or they feel not protected. What's the word? Well supported. They feel well supported in the fact knowing that I'm around, they can ask questions and bounce off me. And although that is nice, then there's another level of kind of, let's call it dread, right? Which comes up in your mind, which is like, it's really nice that I make you feel like that, but then it's like, oh shit, man. So you're kind of depending a little bit on me. And it's like when you come to me, I better have an
Yeah.
answer for you. So, and look, it doesn't matter how senior you are, there are some things you just don't know. Right? But that's okay.
That's
And the people
pressure.
think that's yeah, well, it's pressure, but it's medicine. And it's just like I tell all my juniors, I was like, look, some things I won't know. When I don't know, I just tell you I don't know. But the thing that happens with seniority is you just like, okay, I don't know, but how am I gonna know? So like, who do we need to ask? What do we need to Google? Where do we need to go with this? Right? Rather than, oh shit, I don't know. That's gone now. You're never ever gonna know everything. But experience definitely is the best teacher. Um, but yeah, I just thought that was a really, really nice feeling. You know, I've had it in, I'd say, a few different aspects of my life, that kind of feeling. Um, but it was just nice. It was just nice looking at that, like, oh wow, like, you know, when I started as a doctor. So I guess this is more a reflection about being a doctor. When I started as a doctor, you start with kind of, you know, I was an organized person. I thought I was pretty efficient, but the confidence doesn't come just from day one, you know, and that comes over time. And then somehow you just wake up one day and you're like, oh wow, I know stuff without really having to think about it, or I know how to manage a situation, or I know
Yeah.
the thing that you're scared about because I've been through that exact same scenario, and I can just give you bang, 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 like a few golden nuggets, stuff that's taken me 10 years to learn. I'll tell you like in like 3 sentences, and you've got it, and your like anxiety is completely dissipated. I'm talking about other junior doctors here, not patients. Um, so yeah, that was nice being a leader.
ਤੁਸੀਂ ਬਿਗ ਬੋਏ ਆ ਹਨਾ look at you
Big boy.
ਵੱਡਾ ਅਮੇਜ਼ਿੰਗ ਬੰਦਾ ਹੈ
Big. Yeah. Jake के amazing कहने मनु. Just Karan. You like that? You like that, didn't you? You like that, didn't you? Just came up with
just
that shit.
Karan there you go just Karan
Just Karan. Huh? Just do it, man. They come to me like, Dr. Jazz, what do I do? I'm like, just do it, man. You do the right thing. um, yeah, so this the whole thing about being a leader, right? And now the thing is, there are a lot of registrars who I work with, but when I observe, I wouldn't say they're all leaders, as in I don't see the same interaction where people are junior doctors are coming to them. Maybe they don't feel comfortable. It's not, and so it's not always that one way. It's sometimes the registrars don't feel comfortable to give advice as well because then they're taking ownership. Giving advice
yeah
in a medical setting, you know, is a lot of responsibility because you're putting your name to something. I check a lot of ECGs. I check pretty much all the ECGs that come through kind of my area. Jazz, can I just pick your brain about this? Jazz, can I pick your brain about this? Jazz, can you look at this? Can you deal with this? And you realize, and I've said this before, that, the higher you go in terms of seniority, essentially what you're becoming is a problem solver. So the actual, do you want me to be a machine and just bang through and see loads of patients? Yes, there are days like that when I sit in that role, but a lot of my role is kind of hybrid roles. It's a lot of deal with this, do this, troubleshoot this, have this, difficult conversation, calm this person down. But that's what I love about it, man. Malcolm Gladwell's book, Outliers, talks about the 3 things you need to have meaningful work, right? Applies to any type of work. And I've had experiences in my life where now in retrospect, when I look at it, the reason why I just did not align with that work and it's really drove me down is because of not having these 3 things. Number 1 is autonomy. Autonomy is good. So, how I get the work done, obviously within the parameters of kind of, moral and ethics, is up to me. And that's good. My time is my time.
Yeah.
We know big picture what we need to do, get it done. So autonomy is important. Changing and varying complexity. So no day is the same. I'm not doing the same one thing every day. I don't see the same patient, don't see the same chest pain. Even if it is chest pain, every chest pain is different. Every person is different. Every story is different. Every problem is different. Every x-ray is different. Every blood test is different. So there's just so much complexity. And the combinations of that, and all what we obviously get good at is pattern recognition. It's like, okay, I've seen this with this with this. Let's try this. Let's try this, this, and this. Yeah. So that's varying complexity. And the third thing is the relationship between effort and reward. However you take that reward. And I'd say definitely, in the 10 years I've been a doctor, there's obviously been highs and lows. But I'd say I've kind of hit, like you said, I'm in a kind of a good flow state at the moment where I'm enjoying my medicine. And it's just, it's an honor and a privilege. So, yeah.
Well done, bro.
Leadership.
I'll actually give you some props there. That's actually very impressive. It's a big realization to see that you're growing up as a person. And also in terms of your output, it's getting higher and higher because you're naturally just putting in the hours and the time into it. And you are pretty much the fixer, which is a pretty big privilege if you think about it, because you've got junior doctors coming up to you unsure of their own ability. You're trying to instill that in them. You're also being called by the head nurse all the time. It's pressure, but you seem to be taking it well. So it's impressive. Very proud.
It's good, man. I guess it's, that curve we look at in terms of pressure, like there's good pressure, bad pressure. And it's just when you're in that, if my caffeine is optimized as well, and the pressure is optimized, man, I love nothing better. It's like I got 5 things on the go. Right, you're there. I'm going to deal with you. You wait there. Fine. Come in with me. Question. Pause. Hold that thought. Yep. What do you need? Bang, bang, bang. You go off now. You come in now. And the bit about junior doctors I really love is because they're so impressionable, right? They're so young in their training. It's like, I've been exactly where you are, right?
Yeah.
So I want to show you that. And I always say to them, I am not clever. That consultant is not clever. We simply have experience. You will get that with time, but you can't accelerate that. Right. So what I want you to focus on is asking good quality questions. Right. This is a chance to learn. This is a time to learn. Don't become a parrot. Learn how to ask good questions. Learn how to become intentional with your language. This is a lot of what I talk about. So I talk about the parallels of, like selling. Okay. So you might not think, selling applies in medicine, but man, you're selling stuff all the time. You're trying to get that scan vetted from the radiologist so you can get your scan done. You need to learn how to sell it. You want the surgeon to come review a patient, sell the patient to them. So they're like, yeah, I need to come and see that patient. And there are really, really subtle things. Like I said to junior doctor the other day, like it's a second rotation as a foundation year 1. I said, look, you pick up the phone and what you say is, hi, I'd like to refer you a patient. I was like, it's too aggressive, man. It's way too aggressive. What you do is you soften it completely.
Yeah.
You say, hi, I'd like some advice. Bang. Softener, right? I'm asking for advice. I'm not asking for anything. I'm asking for advice. Advice isn't, please come and see my patient. Tell them the story. Give them the detail.
Yeah.
And then at the end, I'll tell them to say something like, and what I'm most concerned about, you're telling them your concern. You're not telling what they should be concerned about. I'm telling you my concern. What I'm most concerned about is this. What do you think? Stop. Pause. Say nothing else. Let them come back with a jawab. The response is then going to be either, yeah, I agree with your concern. I need to come see the patient. So they're now deciding that they need to come see the patient. You've sold it to them, right? And this is all language. And I said, look, the better you get at communication with staff, all staff and patients, the easier your job becomes. 95% of my job is made easier if I'm good at communication. And that's one thing I have, I'd say now kind of in the last few years, consciously worked on to hone. It's like that really is the cornerstone of how I can do so much and have impact. and kind of inspire those around me to be like, yep, I want people to enjoy when they're working on the shop floor. It's grueling, right? It's not easy work, but it's like, how can we have a bit of banter, a bit of humor in there, and we get it done. A1
It's
job.
a good approach to have, man. Nice little bit of selling there, channeling your inner Jordan Belfort from the Wolf of Wall Street, with everyone sitting there on the phone while you're saying, yeah, I want to sell you this. I want to sell you this, and people around you are like, oh my God, he's doing it. Wow. How did you do that?
I've actually done that. I've done that on the phone. I've had them around me. I'm like, this is probably the best
Seriously?
thing that I have seen. As in, what I said was, like, I told him, I said, do you want to see me make a referral? Will that help you? And the guy was like, yeah. So I picked up the phone. I said, all right, so tell me the patient. What do you need doing? Jumped on the call. And the thing that biases a little bit sometimes is a lot of people know me now in the hospital. So I'll pick up the phone like, hi, it's Jazz. I'm like, yeah, Jazz, what do you need? But then I also teach them that, look, that's when you get to a level that because I reciprocated. Now, this is the other thing, right? It doesn't matter about seniority. If you show genuine, genuine reciprocation and help and concern, whatever level that person is, they will remember. So then when you need favors, they're not even favors, man. Oh, Jazz, what do you need? Yeah, no problem, Jazz. We'll get it sorted.
Yeah.
Right? And that's a whole different level, man. Like of then you don't have to sell. So, Indy.
Then you're just talking.
Then you're just talking, man. It's just like, it's banter, isn't it? It's easy. Yeah. So, leadership. Leadership in your life. Have you got good leaders? Have you been around good leaders? Are you a leader?
Oh, fucking hell, man. This is a very different direction today.
Dun, dun, dun.
I got good mentors. I've been around good leaders. I've been around really bad ones as well. So good managers, bad managers, being in corporate, etc. I think there's only like 2, maybe 3 managers I've ever had that have been fantastic, and the rest have just been shit. So there's never a middle. Either you do leadership well or you do it really badly, because when you've done one thing badly, it's very hard to come back from that and rebuild your reputation again. It takes a lot of work and a lot of time and a lot of attention to detail. 9 times out of 10, if you've lost the room and you've lost your team, you can't get them back. They kind of just tend to check out and just leave it. So it's very hard to pull back from that kind of position. I've never been in a leadership position per se. I mean, I've mentored others in roles and jobs, but I've not been their direct line manager. I personally don't want to line manage people. I'll do it if I have to, but I've got enough on my plate to worry about. I don't really want to have to think about other people's problems. That's just my own personal thing. But, if it's a needs must and you got to do it for the job, then I'll do it for the job.
Okay. You think you're a leader in the podcast?
Yes.
Yeah, I would agree you are. So how do you find that?
Yeah.
How do you find having to
Fine.
bully me around? Fine. I tell him what
Bully
to
you
do.
around.
He gets it done. No, you're not bullying. No.
But
But there is something you said
leader in the
last week.
podcast.
Go on.
Go on.
I'll tell you.
Go on.
No, okay. You want me to start? Okay. So you said this thing about, and I think we've talked about the art of mirroring, right? So if you're going to be a leader in the podcast, which you are, and then you want to get the best out of me, okay, so you look at my skill sets and my values, and you're like, okay, well, he's clearly efficient, he's this, and this. So how do I cater to that skill set? I think you've identified that really well. So you know that I'm good with people. So one of the things I'm tasked with is, well, how do we build our team? How do we outsource and build our freelance team to do the things we do? So that's one of the things I look into, right? And then the other thing is you communicate with me the way I like to be communicated to. That's an advanced level skill.
Yeah.
That you do. So,
Yeah.
But you want to come in now, go on.
I don't think management is linear. I think every person you manage is different. I listen to a lot of people who have spoken about football managers admirably, and some will say, he did this for me. Oh, but he did that for me. So for example, Alex Ferguson, he would rip into Wayne Rooney in the changing room, and he would be referencing something he didn't do, but it was another player who did it. So they got the message, because he knew if he laid into that player, it would destroy his confidence, but he knew Rooney could take it. So he would have a go at him and scream at him, knowing he's going to get a reaction. He's sitting there like, I ain't fucking done nothing. But he understands the game at play. The same thing about if he gives praise to Rio Ferdinand for keeping a clean sheet, he knows he'll check out and he'll concede a goal. So he doesn't give him praise in that way. He just keeps him ticking along, because he's a master psychologist, and he taps into you in a different level. Now I notice that some managers are doing that a lot differently, because players nowadays are a lot softer and they can't do the same kind of thing. So they have to be very attentive to their needs and wants in order to get the best out of them. So it's a different world now, and I think leadership evolves over time. I don't think courses are the way to do it. I think you kind of have to observe people, understand them, see what they need, and how they want to be led in a way. Obviously, people are going to come in not knowing what they need, and you got to obviously throw shit at the wall and see what sticks. But I'm not fascinated by leadership. I find it interesting, but it's a fucking tough ask as a job. I sympathize with people who have to do it in work day in, day out.
Okay, fair enough. I agree. It's not something that can be particularly taught in courses. You can learn strategies and basic things, but you need to basically try stuff out. And you're right, every person is different. But once you work out let's say the in, right? Let's call it the in. You got the in, we've got some kind of neutral ground here. We build that base relationship and then you add to it. That's one thing I've learned as well over time. You're not going to have the same level of, let's say, banter or relationship with everyone, and you don't need to. That's fine. But as long as you maintain where it is, over time you'll build where things, and that will just happen organically and naturally. I've had lots of great kind of, friends format of work just from that. It's like started as, okay, maybe you just talk about medicine. Now we're not talking about medicine. Now we talk about medicine and other stuff. Just organic, isn't it? And then there's that confidence about, you can ask me stuff, I'll ask you stuff. And that's it.
Yeah,